जी पापा, नमस्ते। नहीं अभी जस्ट हॉस्पिटल पहुंची हूँ मैं। नहीं रिपोर्ट्स नहीं आई है अभी तक। हाँ मैं एक बार रिपोर्ट्स ले लूँ फिर आपको बताऊंगी क्या है। हाँ ज़्यादा सीरियस नहीं होगा। ठीक है, आप रेस्ट कीजिए, मैं आपको कॉल करूँ। बाय पापा। हेलो पापा। हाँ जी रिपोर्ट आ गई है। नहीं ऑलमोस्ट सब नॉर्मल ही है। मैं घर आके बताती हूँ आपको। हाँ अरे मैं 5 मिनट में घर आके बताती हूँ। ठीक है, बाय।
I think when I was a surgical trainee, I was working in a unit in AIMS where my guide was closely working with breast cancer patients. And while doing my post-graduation, that area captured my interest, and I realized that there's a lot of unmet need, especially for women surgeons, because the burden of the disease is growing, and I decided to specialize in this field. So, the symptoms of breast cancer are, like you rightly said, often overlooked by a lot of people. That's because the most common symptom is a painless lump. Most women, what they do is, if they have pain in the breast, everyone comes and, goes to a doctor, a gynecologist, whoever they can access. But a painless lump, because of shame, fear, variety of factors, they'll ignore. So, the warning signs are actually any painless lump, any change in the size or shape of the breast, any clear or bloody nipple discharge which is happening on its own, that is spontaneously, any change in the skin of the breast. So if the breast skin suddenly becomes puckered or red or dimpled, it can be a warning sign. Any swelling or lump in the armpit can also be a sign of breast cancer. And nipple retraction, if the nipple suddenly goes in, that can also be a warning sign of early breast cancer. Or any scaling or wound on the breast or the nipple can be a sign of breast cancer. So a lot of people are scared of mammograms because first they think that there'll be radiation exposure which may be harmful. They think it will be painful. Actually, mammograms are very simple tests. They are basically X-ray of the breast, but the catch is they are useful for women above a certain age. So we advocate mammograms for women above the age of 40 if they have no complaints. If someone is fine and they want a routine checkup, a mammogram should be done or offered once in a year or once in 2 years after the age of 40, because it helps in catching cancer early. And the main thing is that if you catch breast cancer early in stage 0, 1 or 2, you can get more than 90% cure rates. Then you don't have to lose lives. But if you detect cancer in stage 3 or 4, the cure rates dip drastically to 60%, 50% or even lower than that. And that is why awareness about warning signs of cancer, awareness about starting screening mammograms after age 40, and something else, breast self-examination. Every woman should be in the habit of checking their breasts once a month. You have to just get into the habit of knowing how your breasts look and feel, so that if you notice any change which I had listed earlier, any lump, any change in size, shape, you will be able to report to your doctor. And that should start right from the age of 18. It is curable. It is, like I said, very high cure rates if detected early. Whenever a patient walks into my OPD, the very fact that they have been told to visit a doctor in the onco OPD or the cancer OPD, they are so stressed. They think breast cancer means end of life. It's deadly. That's not true. We have very high cure rates, so that's a myth I want to bust, that there's nothing to fear. But yes, please do not delay diagnosis and treatment. Do not fall for any alternative kind of pathways. The other thing is biopsy spreads cancer or causes cancer. So what happens is, the moment a lady comes to my clinic or any surgeon's clinic with a breast lump, we'll get some ultrasound or mammogram, some basic imaging done. And if needed, not in all cases, but if there is any worrisome sign or any doubt, we'll ask for a biopsy. A core biopsy is the basic test which is required to diagnose cancer, and it is very simple, it's very safe. But people are so scared. I know of people who went to a doctor, were advised a biopsy, and they disappeared because they felt that biopsy will cause cancer and spread cancer. That is a myth. It's a safe test if done rightly, properly. Actually, that's a very important question, because only 5 to 10% breast cancers are genetic or hereditary. 90% are not. Most cancers are sporadic, environmental. There'll be some familial clustering. There'll be some 10% people who'll have a strong family history. But for most, you may be the first person in your family who'll be diagnosed with breast cancer. And lifestyle factors, it's been shown that weight gain in postmenopausal women, that means women after they cross 50, after their periods stop, if they gain weight, alcohol intake, lack of exercise, all these things, a sedentary lifestyle, all these things increase the risk of not only breast cancer, some other cancers and a variety of other diseases as well. Also, certain things which often women end up opting for, like no childbirth or delayed childbirth, lack of breastfeeding, all these things also lead to excess hormonal exposure and increased risk of breast cancer. I think the landscape of breast cancer treatment has really transformed. In the last 10 years only, we've seen so many changes in the field of surgery, in the field of the surgical aspect of breast cancer management. Almost like 70% of our patients have breast conservation now. Mastectomy, that means removal of breast, is not required. Oncoplasty, we have newer plastic surgery techniques which can be used so that the breast size and shape, the cosmetic outcome can be maintained. We have reconstruction options, skin sparing mastectomies, basically a lot of ways in which a woman does not need to lose, the look and feel of a breast. In treatment, other treatment options, we have a lot of newer therapies, targeted therapy, immunotherapy, a lot of newer agents and radiation therapy techniques, a lot of development in genetics and precision medicine, which has helped us in understanding cancer better and really treating our patients in a much better manner. So thankfully, like I told you, now we do end up doing mastectomy. Some breast cancer patients do require breast removal, that is mastectomy. But even for those, there is an option of whole breast reconstruction. That means plastic surgery, where you use either the person's own body fat or muscle from the belly area or from the back to recreate a breast, or use an implant, a silicone-based structure to recreate a breast. Oncoplasty is also used in breast conservation. Earlier, what used to happen is, if a tumor is removed, the breast used to become really small. Now we use a lot of local plastic surgery techniques so that the cosmetic appearance of breast can be maintained and a woman's body image and confidence and sexual life is not shaken after her breast cancer treatment. Actually, it's very, very important. Not only breast cancer treatment, but any health issue, any physical or mental issue, needs a lot of emotional support from a person's family, caregivers, friends, office colleagues, and everyone. And that's why generally we have a caregiver group in our hospital. We have a patient support group in our hospital. We ask our psycho-oncologists, our counselors to be in regular touch with our patients so that they are equipped to handle the stresses. See, we can manage the physical part of the problem, but the mental part is equally important, and the family needs, guidance and support, because sometimes it becomes overbearing to know that your loved ones are going through a tough journey. But there are a lot of avenues open now, and we encourage people to reach out and ask for help, even if it's not being directly offered. So I think every patient I meet and every patient we treat, every family, they really touch us and they teach us so many things. In fact, I think when people ask me, isn't it depressing being around cancer patients and treating cancer and breaking cancer diagnosis news to people, I find it not at all depressing. I find it, I find that it helps me develop a sense of gratitude for everything in life and to put things into perspective. So, in fact, just today we are starting treatment of a mother-daughter duo. The daughter had come, she was 42-year-old, she was traveling with her children for some holidays, and just the day before she was traveling, she felt a lump. She came, and she's a working mother, early 40s, and she felt a lump, and unfortunately it has turned out to be cancer, and we've just started her treatment today. And it's just a small example I'm giving. And what happened was, the first time when she came, her mother told me that I think even I should get a checkup done. And I examined her and got some basic tests done, and unfortunately even she has been diagnosed with breast cancer. The mother is around 65, the daughter is in early 40s. So it's I don't know whether it's inspiring or heartbreaking. It just tells us that we have to really be kind and empathetic to each other, because any of us can be in those shoes. It's not something which happens to random people now. It's a part of our world. We have to be aware, we have to be kind to each other, and we have to just hold each other's hands throughout the journey. See, there's nothing to fear. I understand cancer is a scary word. I understand that you're scared, you're anxious. But please do not ignore any change in your body. Not only in breast, anywhere in your body. If there's any unexplained persistent symptom, do not take it for granted. Do not ignore, because healthcare has really advanced. It's not that cancer or any disease is not treatable. Denial just leads to delay in diagnosis. It just increases the problem for you, your family, and your healthcare providers. And I can understand that sometimes people have financial, emotional, a lot of constraints. But there are NGOs, there are so many agencies which are working. And if you come forward and ask for help, I'm sure we can all join hands and help get more and more women get correct treatment, early treatment, and help save lives. I think all of you young people are doing a fantastic job. You have to just continue asking questions, spreading awareness. That is most important. See, healthcare providers are doing their role, public organizations, health organizations are doing their role. But you have to help us break the stigma that, people shouldn't hesitate. They shouldn't feel shy that there's a problem in the breast. How can I talk about it? We have to break the stigma. We have to create awareness that symptoms are very subtle. Do not ignore any change, and there is no shame in talking about it.